Did you know that the use of antipsychotics in dementia patients can lead to more harm than previously acknowledged? This is the striking revelation from a recent study published by the BMJ. It seems that these widely used medications, frequently prescribed to manage behavioral and psychological symptoms in dementia patients, could be associated with a broader range of serious adverse outcomes than we thought. Stay with us to understand the implications of this study and why it matters to you. You might wonder, what are antipsychotics? Well, antipsychotic drugs are a class of medications primarily used to manage psychosis, including delusions, hallucinations, paranoia, and disordered thought, primarily in schizophrenia and bipolar disorder. They also serve a purpose in the treatment of dementia, though not without controversy. Now, dementia is a group of conditions characterized by impairment of at least two brain functions, like memory loss and judgment. This impairment often leads to behavioral and psychological symptoms, such as depression, anxiety, aggression, and psychosis. It's here that antipsychotics come into play. These drugs are often prescribed to manage these symptoms, providing relief to patients and caregivers alike. But it's not all smooth sailing. Antipsychotic use in dementia patients has been linked to a range of serious adverse outcomes. We're talking about stroke, heart attack, heart failure, acute kidney injury, and even death. And these risks, studies show, are highest soon after starting the drugs. So, while these medications can offer immediate relief from distressing symptoms, they're also a double-edged sword. They come with a considerable risk, underscoring the need for increased caution, especially during the early stages of treatment. This highlights the complexity of treating dementia. It's a delicate balance between managing distressing symptoms and ensuring patient safety. And with recent findings suggesting a wider range of harms than previously acknowledged, it seems we might need to reassess our approach. Despite their common use, recent findings suggest that these drugs may cause more harm than good. So what does this study tell us exactly? Well, let's break it down a bit. The researchers undertook a comprehensive investigation into the risks associated with antipsychotic use in people with dementia. They were particularly interested in several adverse outcomes potentially linked to these drugs, including stroke, major blood clots, heart attack, heart failure, irregular heart rhythm, fractures, pneumonia, and acute kidney injury. To conduct the study, the researchers utilized linked primary care, hospital and mortality data in England. They identified a sample of 173,910 people, with 63% of them being women. These individuals were diagnosed with dementia at an average age of 82 between January 1998 and May 2018. Importantly, none of them had been prescribed an antipsychotic in the year before their diagnosis. Next, the researchers matched each of the 35,339 patients prescribed an antipsychotic on or after their dementia diagnosis with up to 15 randomly selected patients who had not used antipsychotics. This was to ensure a fair comparison. Any patient with a history of the specific adverse outcome under investigation before their diagnosis was excluded from the analysis of that outcome. So, which antipsychotics were most commonly prescribed? The list includes risperidone, quetiapine, haloperidol, and olanzapine, which together accounted for almost 80% of all prescriptions. The researchers also considered potentially influential factors, including personal patient characteristics, lifestyle, pre-existing medical conditions, and prescribed drugs. And it's important to note, folks, that this study is observational in nature. That means it can't definitively prove cause and effect. It can only identify potential associations and trends. But these associations can be incredibly insightful and inform future research and clinical practice. With this data in hand, the researchers were able to draw some startling conclusions. But we'll get into those findings in the next scene. Stay tuned. The results may just change the way we think about the use of antipsychotics in dementia care. What were the findings of this research that have caused such concern, you may ask? Well, let's delve into the specifics. The study identified a significantly increased risk of a broad range of serious adverse outcomes linked to antipsychotic use in people with dementia. These outcomes included stroke, major blood clots, heart attack, heart failure, fractures, pneumonia, and acute kidney injury. The researchers examined the health records of almost 174,000 people diagnosed with dementia over a 20-year period. They compared those who had been prescribed antipsychotics with those who had not. The most commonly prescribed antipsychotics in the study were risperidone, quetiapine, haloperidol, and olanzapine. The results were quite startling. Antipsychotic use was associated with increased risks for all outcomes, except for irregular heart rhythm. For instance, in the first 3 months of treatment, the rate of pneumonia among antipsychotic users was nearly 3 times that of non-users. 1 year into treatment, the rate was almost double. The risk wasn't confined to pneumonia. Antipsychotic users also faced a 1.7-fold increased risk of acute kidney injury and a 1.6-fold increased risk of stroke and major blood clots compared to non-users. Interestingly, the risks were highest during the first week of antipsychotic treatment, particularly for pneumonia. This suggests that the early stages of treatment require particular caution. But these risks aren't just abstract figures, they translate to real-world implications. The researchers estimate that for every 9 patients treated with antipsychotics over the first 6 months, there might be an additional case of pneumonia. Over a 2-year period, for every 15 patients treated, there might be another case of pneumonia. Similarly, for every 167 patients treated with antipsychotics over the first 6 months, there might be an additional case of heart attack. Over 2 years, for every 254 patients treated, there might be another heart attack. So the findings of this study underscore the necessity for increased caution, particularly in the early stages of treatment with antipsychotics. The risks are not just theoretical, they translate into real-world numbers. How do these findings translate to real-world impact? You might be wondering. To put it in perspective, let's consider the estimates provided by the researchers. For instance, within the first 6 months of treatment, antipsychotic use could potentially result in 1 additional case of pneumonia for every 9 patients treated. That's more than 10% of patients experiencing a severe respiratory illness that they might not have otherwise contracted. In the context of an elderly population already vulnerable to such diseases, this is a sobering figure. But it doesn't stop there. The researchers also estimated that for every 167 patients treated with antipsychotics, there could be 1 additional heart attack. Heart attacks can be life-threatening and often result in long-term health complications. The potential for such a serious health event to occur as a result of antipsychotic treatment is a concerning revelation. When we extend the timeline to 2 years, the risk remains elevated. There might be 1 additional case of pneumonia for every 15 patients treated and 1 additional heart attack for every 254 patients treated. To put this into a broader context, consider the sheer number of individuals diagnosed with dementia. With dementia affecting millions worldwide, even a small percentage increase in risk can translate to thousands, if not tens of thousands, of additional adverse health events. Furthermore, these numbers only reflect the risks associated with pneumonia and heart attacks. The study also found increased risks for stroke, major blood clots, heart failure, fractures, and acute kidney injury among antipsychotic users. Each of these conditions carries its own set of serious health implications. These statistics underscore the importance of caution when treating dementia patients with antipsychotics, particularly in the early stages of treatment. They highlight the need for healthcare professionals to weigh the potential benefits of antipsychotic treatment against these significant risks. Ultimately, these figures are not just numbers on a page. They represent real people, real lives, and real families that could be impacted by these adverse outcomes. These are significant numbers that cannot be ignored. What does all of this mean for patients and healthcare professionals? The findings unveiled in this study underscore a significant concern. Antipsychotics, though commonly prescribed for certain behavioral and psychological symptoms of dementia, are associated with a wider array of serious adverse outcomes than previously acknowledged. This new understanding necessitates a re-evaluation of our approach to the use of these drugs, particularly in the treatment of our elderly population. The study highlights a critical point. Risks are notably highest soon after starting the drugs. This is a crucial piece of information for healthcare professionals. It underlines the importance of exercising extreme caution in the early stages of treatment and the need to closely monitor patients during this period. It is also a prompt for healthcare providers to explore alternative treatment methods. The goal should always be to minimize potential harm to patients while still effectively addressing the symptoms they experience. This could mean considering non-pharmacological interventions for managing behavioral and psychological symptoms of dementia, or using other medications that may pose less risk. For patients and their families, the study provides valuable knowledge that can aid in making informed decisions about treatment. It serves as a reminder that all medications have potential risks, and the decision to use them should be made with a comprehensive understanding of these risks. Advocacy for one's health or the health of a loved one is crucial, and this includes seeking clarification and asking questions about prescribed medications. In light of these findings, it's also important to reiterate that correlation does not imply causation. The results of this study, while concerning, do not definitively establish antipsychotics as the cause of the adverse outcomes observed. More research is needed to fully understand the relationship between antipsychotics and these adverse outcomes in dementia patients. The use of antipsychotics in dementia patients is a complex issue, one that requires further research and heightened caution. As we continue to strive for the best possible patient outcomes, it's crucial that we remain open to new information, adaptable in our approaches, and always prioritize the safety and well-being of our patients.